guys, welcome to my channel. So today we will going to discuss about the general anatomy. So let's begin with the very basic term, that is anatomy. It is the study of the structure of the human body, which is further divided into two, that is gross anatomy and histology. If we talk about gross anatomy, then it is studied on dead preserved bodies, that is cadavers, usually with naked eyes. So that's why it is called macroscopic anatomy and also cadaveric anatomy. Next is histology, which is the study of minute structures of body parts that can only be seen with the aid of microscope, that is it cannot be studied with naked eyes, and hence is also called microscopic anatomy.
Main approaches of studying anatomy. So we have regional anatomy, systematic anatomy, and clinical anatomy. Also, regional and systematic anatomy comes under gross anatomy. Regional anatomy. So in it we consider the body as organized into segments or parts like thorax, head, neck, abdomen, upper limbs, lower limbs, etc. It is also known as topographical anatomy. Next is systemic anatomy. So it sees the body as organized into organ systems like integumentary system, skeletal system, muscular system, articular system, nervous system, circulatory system, cardiovascular system, lymphatic system, digestive system, respiratory system, urinary system, genital or reproductive system, and endocrine system. So first is integumentary system. It consists of the skin and its appendages like hairs, nails, and sweat glands. If we talk about skin, then it is an extensive sensory organ that forms the body's outer protective covering and container. The skeletal system, it consists of bones and cartilage, which provides our basic shape and support for the body and is what the muscular system acts on to produce movement. It also protects vital organs such as the heart, lungs, and pelvic organs. Next is articular system. So it consists of joints and their associated ligaments, connecting the bony parts of the skeletal system and providing the sites at which movements occur. Muscular system. It consists of three kinds of muscles: skeletal, smooth, and cardiac muscle. If we talk about skeletal muscles, then they contract to move or position parts of the body, whereas smooth and cardiac muscle propels, expels, or controls the flow of fluids and contained substance. Nervous system. It consists of the central nervous system, that is brain and spinal cord, and the peripheral nervous system, that is nerves and ganglia. Together with their motor and sensory endings, the nervous system controls and coordinates the functions of the organ systems, enabling the body's responses to and activities within its environment. Next is circulatory system. So it consists of the cardiovascular and lymphatic systems, which function in parallel to transport the body's fluids. Cardiovascular system. It consists of the heart and blood vessels that propel and conduct blood through the body, delivering oxygen, nutrients, and hormones to cells and removing their waste products. Moving to next, we have lymphatic system, which is a network of lymphatic vessels that withdraws excess tissue fluid, that is lymph, from the body's interstitial fluid compartment, filters it through lymph nodes, and returns it to the bloodstream. Alimentary or digestive system. It consists of the digestive tract from the mouth to the anus, with all its associated organs and glands that function in ingestion, chewing, deglutition, digestion, and absorption of food and the elimination of the solid waste. Respiratory system. It consists of the air passages and lungs that supply oxygen to the blood for cellular respiration and eliminate carbon dioxide from it. The diaphragm and larynx control the flow of air through the system, which may also produce tone in the larynx that is further modified by the tongue, teeth, and lips into speech. Next is urinary system. So it consists of the kidneys, ureters, urinary bladder, and urethra, which filter blood and subsequently produce, transport, store, and intermittently excrete urine. Reproductive system. It consists of the gonads, that is, ovaries and testes, which produce oocytes and sperms, the ducts that transport them, and the genitalia that enable their union. Endocrine system. It consists of number of glands that secrete chemicals known as hormones into the blood. Endocrine glands are ductless glands, meaning their secretions are directly poured into bloodstream. Now the last approach of studying anatomy is clinical anatomy, which emphasizes application of anatomical knowledge to the practice of medicine. It incorporates the regional and systematic approaches to studying anatomy and stresses clinical application. Different body positions used clinically. Anatomical position: supine, prone, lithotomy position, left lateral recumbent, right lateral recumbent, Fowler, Zer's position, and Rindelenburg. Now let's see them one by one. So first is anatomical position. A person in this position stands straight with eyes looking forwards, both arms by the side of body, palms facing forwards, and both feet together. Next is supine position. A person in the supine position is lying on his or her back, arms by the side, palms facing upwards, and feet put together. Next is prone position. A person in the prone position is lying on his or her face, chest, and abdomen. Right lateral recumbent. This means that the patient is lying on their right side, as you can see in this picture. Moving ahead, we have left lateral recumbent. In this position, the patient is lies on their left side. Next is Fowler's position. A person in this position is sitting straight up or leaning slightly back. Their legs may either be straight or bent. Trendelenburg position. So a person in this position is lying supine with their head slightly lower than their feet. Thank you. Hope you liked this video. If you do, then do subscribe to our channel.